Hi, my name is Dr. Lindsey Zubritsky, and I'm a board-certified dermatologist. I'm here today to talk to you about melasma, also called the mask of pregnancy. Melasma is extremely common in women who have been pregnant. However, melasma is not always caused by pregnancy. There are several other things that can induce melasma, such as anything that can change the hormone levels in your body, like starting or stopping a birth control pill or hormonal replacement. Melasma is a common condition that results in hyperpigmentation that is typically ill-defined, and it appears very commonly on the forehead, on the bridge of the nose, on the cheeks, around the eyes, and around the lips. It can even sometimes look like a darkened mustache above the upper lip, which can be very distressing to patients. Melasma can occur during or even after pregnancy. Melasma is very common in those of a darker skin of color patients, or a darker Fitzpatrick type. So we typically see this in Latin Americans, Native Americans, Asians, and African Americans. So the cause of melasma is unknown. However, we do know it has something to do with the changes or fluctuations in hormones. But one of the biggest causes and triggers of melasma is UV exposure. Sun protection for melasma is absolutely vital and key, and something that needs to be taken very seriously. Many even when it, you can't just put sunscreen on every single day in the morning and that's it. You need to apply SPF at least 30, but I typically recommend SPF 50 to 100 every single day, regardless of the weather outside, regardless of the season, and regardless of whether you will be outside that day for an extended period of time or if you will be indoors. Studies have actually shown that blue light, which is the light from our computer and our cell phone screens, can worsen and trigger melasma. So even if you're inside all day long, you still need to be wearing sunscreen. Another important step that you have to take is reapplication. So again, it's not enough just to apply sunscreen in the morning. You have to be applying it multiple times throughout the day, especially if you're outside working or on a sunny beach vacation. So I do recommend application every 2 hours using a mineral-based sunscreen, again with an SPF of 30 to 50, if not 100 SPF. I also recommend wide brim hats, long sleeve shirts, and sunglasses to really ensure that your melasma does not flare. Once you've made sure that you are being very diligent about sunscreen and sun protection, you can start to look at different topical therapies. It's best to see a board-certified dermatologist for prescription-based medications. Some of the ingredients that work very well for melasma include lightening agents like hydroquinone, kojic acid, topical retinoids, and vitamin C. Several pharmacies can compound some of these ingredients together into one product to make it easier for the patient to apply. These medications can be irritating, so I do recommend that if you're using them, to only use them a few times a week at first until you're able to tolerate daily. And of course, always use these melasma treatment products with sunscreen. When using something like hydroquinone, it's best to use it under the discretion and supervision of a dermatologist. I do recommend using hydroquinone-based ingredients only for a short period of time before taking a break. Typically, I'll recommend a 2-week on, 1 week off, or 2-month on, 1 month off use of hydroquinone. While using hydroquinone, it is very effective. However, if you overuse it and do not take holidays, you can develop a paradoxical hyperpigmentation called ochronosis, which is where you actually develop more hyperpigmentation through overuse of hydroquinone. There are other treatments that a dermatologist can use or prescribe to help with your melasma. Such treatments include laser therapy, microneedling, or chemical peels. It's best to make an appointment with your board-certified dermatologist to ask them about these procedures as well as the risk and benefits involved. It's also important that you avoid any type of procedures that could potentially irritate your skin, such as waxing. Damage and irritation to your skin can worsen melasma as well. If you have any questions or issues, I recommend seeking advice from a dermatologist to help.